Hey, how are you doing today? My name is Logan, and I'm going to be your nurse. Alright, and if you don't mind for me today, can you go ahead and confirm your name and your date of birth before we get started? Alright, Miss Smith, everything sounds good. So the doctors go ahead and ordered me to insert a Folley catheter for you today. I don't know if you've had a procedure like this done before, but what we're going to basically do is insert a tube into your urethra down to the bladder. It's going to drain some of that urine. It's going to allow us to collect samples and stuff like that. Before we get started today, do you have any latex or iodine allergies? No? Alright, sounds good. So the first thing we're going to have to start off doing, Miss Smith, is we are going to have to provide a little peri-care. It's going to help prevent infection. But before we get started, do you have any questions for me? All right, awesome. We'll go ahead and get started. And so I'm going to place Miss Smith in dorsal recumbent position. That's the correct position for females, and it's going to provide the most ease. But we're going to leave her draped for now to preserve modesty. While we go ahead and start doing our peri-care, and we are going to wipe from top to bottom. Alright. Alright. And so we're going to go ahead and get started. We're going to place the bag for our catheter down there to use for trash. I'm going to go ahead and get our catheter kit started. And grab by here to preserve our sterile field. And so, go ahead and get here. We're going to start our sterile gloving. Go ahead and sanitize again. Everything's clean. And don our sterile gloves. Out, close, then 2 fingers, open it up, a little pinch here, and sterile can touch sterile, so we are able to pinch the fingers and get everything on there correctly. Alright, so the first thing we're going to start off doing is, now this is our sterile field, we're going to go ahead and get our pad, and we're going to lay it down here. This will help extend our sterile field as well as provide an absorbent pad so no fluids get into the bed. So, set this to the side. Alright, so we're going to go ahead and start off with our iodine solution. And what we're going to do is we are going to squirt that onto the cotton balls. That's going to allow for antiseptic. And we're going to go ahead and get our lubricant. And squirt a bit down here into the container. And trash that. Alright. And now what we're going to go ahead and do is discontinue this. And trash. Alright, so the next step, we're going to go ahead and test our balloon to make sure everything works properly before we try to go ahead and insert. Alright, we'll go ahead and insert all 10 milliliters. Alright, and everything looks good, so we can go ahead and deflate the balloon. All right. All right, and so the next thing we're going to do is we are going to sanitize this way. And now this hand is no longer sterile, so we'll have to keep it here. We can no longer touch any of this equipment. And so we are going to go ahead and start. To clean, you'll wipe one side of the labia, drop, grab another one. The other side, drop, and then you'll spread, wipe down the middle, and drop. And you're done with this for now. So then what we're going to go ahead and do is we're going to go ahead and get our tip lubed up so that it will be easier to insert. We will go ahead and spread the labia and insert the catheter. So what you're going to do on a female patient is you will insert the catheter until you start to see urine go down the line. And after that point, say right now, we just saw urine start to come down. We're going to insert another 1 to 2 inches to make sure the catheter is completely inside the bladder, because we don't want to inflate the balloon inside the urethra. That's going to cause great discomfort for the patient. It's just going to be bad. So we'll insert another 1 to 2 inches. All right, so there we are. And we can go ahead and inflate the balloon. So at that point, what we can go ahead and do is we're going to take the bag. We will go ahead and tape the catheter to Mr. Smith's thigh. All right, and that is stuck down. And we will go ahead and attach the bag to the bed, not the bed rail, but the bed frame, which is down here for us. All right, and so say the doctor ordered us to collect a urine sample. Immediately, after we insert the catheter, we can collect that sample straight from the bag, but later on you don't want to do that. Say later on you want to collect your urine sample here straight from here on the catheter. And now we are done with all of these supplies here. You can go ahead and trash everything. That's trash can. All right. And so we've left, and now it's time for us to discontinue the catheter. Our patient will have, of course, been here for several days. Not several days, but several hours. Ms. Smith would have been comfortable. We would have made sure that before we had left. Now we come back, and the doctors ordered us to discontinue the catheter. We come in like we did earlier. Ms. Smith, could you confirm your name and your date of birth? Everything checks out here. So Ms. Smith, what we're going to go ahead and do is we're going to discontinue the catheter. It's going to be similar to what we did the other day. We're going to have to get you in the same position and go ahead and get you in that. So we will come back, we will return Ms. Smith to the dorsal recumbent position. And what we can go ahead and do is pull like this and remove the tape from the thigh. And what we want to do is slowly discontinue the catheter. And Ms. Smith, if the pain gets too unbearable, if it proceeds beyond mild discomfort, I want you to let me know. You're going to pull slowly but steadily. Make sure to never let go of the catheter. And there we are. You can take this now, remove it from the bed frame, and discard of it appropriately. And that is how you insert and discontinue a urinary catheter.